system and cardiovascular system. So respiratory means those elements of our body, those members of the body that help with breathing, gas exchange. While cardiovascular system consist of the members that help with the movement, the transportation of materials within the body. All right, transportation of oxygen, nutrients, electrolytes, water. Even what do you call it? Waste product. Waste product produced in the body must be removed out of the system. So cardiovascular system is very, very important. So here, there are 3 members here. This consists of 3, right? The main is what? Lungs. Lungs. That is the main. The main contributor, key player. The main key player there. And then you have airway. Yesterday we spent a lot of time talking about airway, which is the tube linking the lungs to the outside through the nostrils. Okay, trachea, you run through the roof of the mouth, through the trachea and emptied at the lungs. Okay, that is the vehicle through which gas moves in two directions, in, out. Okay, so that's airway, that passage. And then you have diaphragm. Diaphragm, which is the biggest muscle for breathing, diaphragm. I hope that is the spelling, diaphragm. So diaphragm, the biggest muscle for breathing. Okay, is this dome-shaped. This dome-shaped muscle here. So when you breathe, it goes like this. That's the biggest muscle for breathing, diaphragm. Okay. So any emergency that affects this is respiratory in nature. Yesterday we covered some of them. Can we mention some emergencies that are respiratory in nature that affects respiratory system directly? Anyone? Any emergency? We did yesterday. Asthma. What is the spelling of asthma? What is the definition of asthma? Inflammatory airway condition. And we talked about mucus that is produced during asthma and causing congestion of the airway. And when the airway is congested, breathing becomes tough. We did those things yesterday. What other emergency affects the respiratory system directly? Allergic reaction too. Remember, one of the signs and symptoms of allergic reaction is the tightening of throat. And this is where the trachea is. If this area is swelling, that is dangerous. That is very, very dangerous. So allergies, allergic reaction, okay, allergic reactions, especially anaphylaxis type. Anaphylaxis type. The one that can lead to anaphylactic shock. This one. So yes, so is in fact, remember that one of the ultimate consequence of this is respiratory arrest. So when you talk about respiratory arrest, 2 of them can lead to respiratory arrest. It means the lungs have collapsed. The lungs are disabled from functioning. That's what it means. So it's respiratory. Another one is choking. Choking. When people choke on food, remember that choking is airway obstruction by a foreign object. Airway, again, airway here. And the airway is the pipe, the only pipe which oxygen gets to the body. The only route, or people call it route, that's the only road through which oxygen goes to the body. Only one. So if that one is blocked, that's it. If nothing is done to help this person, he's a dead person. So it's respiratory. Okay? So we have seen some of this. It's only choking that we need to see, but we have covered the asthma already. We have covered the allergic reaction. The one, remember, anaphylactic shock, the one you use EpiPen. Yeah? That is that. We covered yesterday. Now, let's see cardiovascular. Okay? Now, cardiovascular is responsible for circulation. This one is tasked with circulation responsibility. And you know that is a key function. This one is the transport system. It moves things around us, blood. So through blood, everything we need gets distributed. Your eye needs some food to function, the ear. Without the food, what is the food of the eye? Oxygen, all the cells, nutrients, electrolytes, like those small magnesium, zinc, those small things we get from fruit, vegetables, when we eat. You know, they get distributed so that the body, the cells will be functioning properly. So without this, there's no movement. And if there's no movement, there won't be life. So that's, remember when we talk about RABC yesterday, right? Yes. We said this, when you do primary survey, you assess for responsiveness, airway, breathing, circulation. And we told you that these are the things that determine life. If anything takes this away, or any of them away, the life is threatened. That's why we call it life-threatening. So, and C, so C here is this. Cardiovascular is the C here. Respiratory we did before is airway and breathing. That's why these two, they are so indispensable. Very, very, very. Very, very indispensable. Very crucial. Okay? So cardiovascular system consists of 3 key members too. 3 key players. So the heart is the main key player. Heart. The heart, which is the pump. The heart is the pump. This is the pump of the body, the pump. The one pumping. That's the work of the heart, to pump. So that blood will get circulated, get going. And the heart doesn't stop. It doesn't go on vacation. If your heart goes on vacation, you're in trouble. Okay? It doesn't retire too. If the heart retires, that means the whole body is retiring. And retirement means the person is going to die. So the heart is every now and again is working, even when we're sleeping. Do you know how many times your heart pumps blood in a day? A whole day, do you know? Do you have an idea? This is transient ischemic attack. So this is stroke. Actually, we're talking about stroke. Stroke. That's what we're talking about. Stroke. So the name, the name is ischemic attack, and this is transient ischemic attack. TIA. So TIA. So stroke is similar to heart attack, but different organs. Heart attack happens to the heart. Stroke happens to the brain. But the mechanism is the same. When I talk about mechanism, I'm talking about blockage of artery. But this time it is the artery that takes blood to the brain that is blocked. So if that happens, let's assume that this is, let's draw, let's assume this is a brain, this is brain, okay, so this is brain. So you have also artery that takes blood to different areas of the brain. Arteries like that. So if there is a blockage here, so blood is flowing, and then it stops here. This area of the brain will not receive blood, and that will lead to stroke. We call it ischemic attack as a result of blockage to an area of the brain. This TIA, transient, is similar to angina. Remember, angina is narrowing of the space. So the same way, if this is the artery to this area, and over time, this area begins to harden because of deposition of oil, fat. So, and it keeps on increasing, and blood is flowing, and then blood is managing to pass because this area is so narrow. Okay, so again, this area will not receive oxygen, enough oxygen, and other nutrients, especially oxygen. So the person will also begin to show the signs and symptoms of stroke. But it comes and goes. It comes and goes, just like angina, but different organ, the brain. So TIA looks like angina, but to the brain. Ischemic attack looks like a heart attack. The only difference is it is to the brain. Why heart attack is to the heart. The mechanism the same. Signs and symptoms different. Now, stroke generally is of two types. One is as a result of blockage like this. 80% of the sample of stroke victims, 80% belongs to blockage. Yes, blockage like this. While 20% is as a result of bleeding in the brain, bleeding. So another reason why people have a stroke is what we call hemorrhagic stroke, bleeding. So that people bleed in their brain, they have brain injury, and then there is bleeding in the brain. Or maybe as a result of high blood pressure. So the artery rupture opens up, and then blood now releases into the brain. That is called the hemorrhagic stroke. 20% of the sample belongs to hemorrhagic stroke. As a result, there's one they call aneurysm. Aneurysm, that is when the blood vessel explodes or ruptures in the brain. So that is that as well. So what are the signs and symptoms of stroke? Signs and symptoms of stroke. So you remember FAS. So there are three of them. You remember the three of them with FAS. F means face drooping. Face droop. So if you look at the person, whether it is this or this, because two of them have the same signs and symptoms. If you look at the person, you see that the face is bending one side. The mouth is bending one side. That is what we mean by face drooping. Another thing you see is arm weakness. Arm weakness. So, if you tell the person to do what I'm doing now, the person cannot do this because the weak part will drop. So one arm, one side is usually affected. In most cases, the other one is one side. So that side will drop because of the weakness. And then speech difficulty. So if you look at their speech or even communication is usually affected. So the way they speak, even understanding will be affected. Because brain, remember something happens, depending on the area of the brain where that happens. Okay? If it happens, especially if it happens on the part of the brain that controls communication, the person will be affected so much. So remember that brain connects to every part of the body. Even your breathing is controlled by the brain. So if the stroke happens to on the part of the brain that controls the breathing, the person may die. It will cut off breathing. Yes. So now first aid is to what? Add the T. Time to call what? 911. So you add the T, make it fast. FAS. Those are the signs and symptoms. First aid is T. Time to call what? 911 or emergency number. You don't give them aspirin, no. Because you don't know whether the stroke is from hemorrhagic. Aspirin will make the person to bleed more.
How did you know, like, if it's a stroke or heart attack? Like,
signs and symptoms.
okay.
That you know.
Yeah.
Okay. Remember heart attack, there's chest pain, dizziness, sweatiness, and then the skin color is changing. The person is feeling like throwing up. The person may even throw up. It's a heart attack or angina. Here, the face is turning, bending. The hand is, yes. The way the person will talk will no longer be the normal way. The person will struggle to talk. So the difference is so clear between two of them. Two of them are 911. Of course, when this happens, it's a 911 call. Stroke is 911 too. The person must go to hospital, medical attention. Okay, this is the thing. So now, yes.
So